Dear ladies and gentlemen,
may I extend to you our cordial greetings.
We are proud to join the remarkable project.
It is dedicated to the human heart and modern achievements in diagnostics and treatment of cardiovascular diseases.
We present to you the agenda of our today's conference associated with the modern methods and skills in curing heart diseases.
The first is the structure of the heart.
The second is cardiovascular system.
And the third is new diagnostic and curing methods of these diseases.
But first, we'll remind you some anatomic terms which will be used during our conference. First is stenting.
Стентування.
To unblock the arteries.
Розблокувати артерії.
Balloon.
Куля.
Plaque.
Бляшка.
Rupture.
Розрив.
Narrowed arteries.
Звужені артерії.
Chamber.
Камери. Ну, камера.
Aneurysm.
Аневризма.
Mesh.
Сітка.
Bypass grafting.
Зондування. Шунтування, вибачте.
Ну, здесь непонятно.
Да.
Tricuspid valve.
Трикуспидальний паль.
Клапан. Триступковий клапан.
Replacement of valve.
Заміна клапана.
Obesity.
Ожиріння.
Thrombosis.
Тромбоз.
It consists of arteries, veins, and capillaries. Heart is a hollow muscular organ and is located in the center of the heart.
Указочка на столе.
The heart wall consists of three layers: epicardium, myocardium, and endocardium. Epicardium is the outermost layer of the heart wall. It's a thin serous membrane that helps to protect and to lubricate the outside of the heart. Myocardium is a muscular middle layer of the heart. It's responsible for pumping blood. Endocardium.
Thank you for your attention. The problem of treating cardiovascular diseases is very urgent because in developed countries more people die from coronary heart disease than any other illness. It kills 1 in 4 men and 1 in 6 women. It happens when the blood supply to the heart is blocked in the arteries by fatty deposits. At present, scientists consider that much attention must be paid to the treatment of cardiovascular diseases.
They are first of all arterial hypertension, then atherosclerosis, particularly of coronary arteries.
The gravest complication is infarction of the myocardium and lastly, a cardiac insufficiency caused by various diseases of the heart.
Considerable headway has been registered lately in diagnostics of symptomatic hypertension.
Methods of diagnostics have been improved to the extent when it is possible to discover symptomatic hypertensions which 10-15 years ago could be found only in 5-6% of patients. 23% of the patients suffering from arterial hypertension.
This is of the great importance of successful combating the arterial hypertension, because the knowledge of the cause of arterial hypertension will make it easier to prescribe its successful treatment.
Definite success has also been achieved in treatment of coronary insufficiency and... Who are you?
We are the hearts.
I'm a strong heart.
And I am a weak heart. Where are we?
At the Medical Society meeting discussing problems and treatment of hearts.
Да не надо. Indeed.
Well, what can you say about our structure? How many valves are there in the heart? Name them.
Oh, sure, they are tricuspid valve, mitral valve, and aortic valve. Valve. Oh, sure, they are tricuspid valve, mitral valve,
My
and
grand
aortic.
always told me that there are weak hearts and healthy hearts.
Unfortunately, I am a weak heart.
And I'm a strong heart. There are many heart diseases which can attack us and different medicines which can protect us.
And by the way, have you known any heart diseases?
Yes, we know some of them.
Can you name them?
Of course, endocarditis, myocarditis, pericarditis, coronary diseases, rheumatic heart diseases, cardiac infarction.
Oh boy, you're a good student. You know so many heart diseases. Even I don't know so many of them.
Here they are. Welcome to our medical festival.
I am myocarditis. Myocarditis is the inflammation of the heart muscle. My disease is atherosclerosis. It involves the walls of the blood vessels of the heart muscle.
And who are at risk?
You are if you smoke, have diabetes, high cholesterol, high blood pressure, and aren't physically active and have obesity.
As you know, cardiac infarction is the #1 cause of death in the world. Let us see and listen to some presentation of cardiac infarction that will be shown to us by students Kibinko from group number 30, Nursing Affairs Department.
Myocardial infarction is ischemic myocardial necrosis that develops as a result of acute disorders of coronary circulation. Symptoms are pain behind the breastbone and in the left arm, shortness of breath, anxiety, and cold sweat. Causes of myocardial infarction are diabetes, obesity, mental stress, passion, alcohol, smoking, physical or emotional stress. And the clinical course of myocardial infarction has 5 periods. The first period is pre-infarction. It can last several hours, days, or weeks. The second period lasts from 20 minutes to 2 hours. The third period acute, from 2 to 14 days. The fourth period is subacute, the duration of 4-8 weeks. And the fifth period is post-infarction.
Well, we would like to draw your attention to different methods of diagnostic heart diseases. Presentation by Andrushik Alexander from group number 30.
Electrocardiography is a method of graphic recording of electrical phenomena occurring in the cardiac muscle during its activity from the surface of the body. Curve that reflects the electrical activity of the heart is called the electrocardiogram. Holter electrocardiogram monitoring is a method of diagnosis carried out with the help of special portable camera recorder which conducts a registration of a cardiogram of a man during a variety of activities for at least some days and sometimes 2 weeks. Echocardiography is a non-invasive method of
Бери. И можешь здесь оставить вместе с коробочкой, чтобы далеко не бегать. Вот здесь на столе можешь поставить, и будешь пользоваться. Вот здесь на текст. Заодно подсматривать будешь.
Я тоже
Это же на это, да?
Хорошо, то вы выйдете, а некоторые не...
Great vessels. Using ultrasound. It allows you to see anatomical features and to evaluate the function of the heart and vessels. Magnetic resonance imaging is a tomography method of investigating of internal organs and tissues with the use of the physical phenomenon of nuclear magnetic resonance.
This is
require diagnostic and treatment. In some cases, doctors may perform coronary artery bypass graft. In this procedure, the surgeon will reroute veins and arteries so that the blood can flow around the blockage. Now we would like to show you a presentation of artery bypass grafting. Please welcome Shvets Yuliana, group number 30, Nursing Affairs Department.
Angioplasty, a surgical procedure, may be also used to unblock the arteries that supply blood to the heart. During an angioplasty, Angioplasty, a surgical procedure, may be also
У нее между презентацией где-то видео пьет, потом она еще продолжает говорить. Которые нет.
used to unblock the arteries that supply blood to the heart. During an angioplasty, a surgeon inserts a long, thin tube called a catheter through the artery to reach the blockage. Then they inflate a small balloon attached to the catheter in order to reopen the artery, allowing the blood flow to the tube.
Thank you for that. Here is another presentation of artery stenting, and we would like to welcome here Skibenko Luba, group number 30, Nursing Affairs Department.
Coronary stents. Stents are small expandable tubes that treat narrowed arteries in your body. They can open narrowed arteries, reduce symptoms like chest pain, help to treat a heart attack. Usually made of metal mesh, they are put into arteries in a procedure called percutaneous coronary intervention or angioplasty. So doctors and companies began testing stents coated with drugs that interrupted and re-narrowing. These are called drug-eluting stents. They are used for people with diabetes who have a bigger chance of their arteries getting narrow again. In 2016, a new type of stent made of a special polymer that eventually dissolves into the body was introduced. This new stent releases a drug called everolimus. Many new second and third generation stent designs are being developed. This stent is absorbed by the body and disappears after it has done its work.
Of the heart. Heart valve surgery is used to replace weak heart valves. The aortic valve and mitral valve are the most common valve to be replaced. Video about valve replacement is offered to you.
Среднее положение поставь.
Another problem of the heart is aneurysm removing. Aortic aneurysms are treated with medicine and surgery. The two main types of surgery to repair aortic aneurysms are open abdominal or open chest repair and endovascular repair. We would like to present you some information about aneurysm removing.
It's a stenting, but with medical treatment but with different medicine. Student Sechova Anastasia is reporting about medicine used in cardiology.
A number of different medications can be used to treat heart diseases. Blood thinners such as aspirin. They are used to break up blood clots and improve blood flow through narrowed arteries. Thrombolytics are often used to dissolve clots. Antiplatelet drugs. They prevent new clots from forming and existing clots from growing. Nitroglycerin can be used to widen your blood vessels. Beta blockers decrease your blood pressure and relax your heart muscle. AC inhibitors can be used to decrease blood pressure. Pain relievers may be used to reduce any discomfort in your heart. Digitalis drugs are...
Вы скажите, что презентация.
Нет? Да. Опять говорить?
Ну, это у нее как доклад. Ну, хорошо.
У меня даже
сразу презентация.
Сделай такую паузу, чтобы я понимала.
Хорошо. Я вот так, я на тебя пустила. Посмотрю на тебя.
А что смотреть? Просто команды, да и все.
Digitalis drugs are Digoxin. It is the most commonly used digital drug. Edison. Digitalis drug. Edison, Gitalan, Digipuren, Cordigit, Lantozid. Beta blockers. They improve cardiac function, reduce the direct toxic effect of norepinephrine. Atenolol and Concor are beta blockers. Beta blockers. Anticoagulants, they prevent thrombosis. Sodium heparin. Вы мне на...
Heparin? Ну что за heparin?
Это вы мне поставили.
Ну я...
Heparin. Okay.
Heparin.
Warfarin, Fluxum, Penilin, and Synchroma.
Nursing in cardiology is very important since a nurse is a chief assistant of a doctor. Presentation Nursing in cardiology will be shown to you by Любовский Петров. В смысле нет? А почему у меня написано? А где?
Now the doctors are changing from angiography, which has been a daily routine, to more complex setup, where cardiologists, echocardiographs, and radiologists work together. It requires close cooperation between these specialties.
Тихо, стой. Stop. We'd like to show you the video about Cleveland. Just no. We would like to show you a video about Cleveland Cardiological Clinic, one of the best clinics
in the whole wide world.
The best cardiologist. At this clinic. Here they save the lives of many patients on a daily basis. The best cardiological clinic in the USA, in Cleveland Clinic, which was founded by 4 doctors. У меня тут мало текста, поэтому... Ничего страшного. Сейчас мне надо дождаться, когда будут doctors. Okay, founded by Kraev, Buns, Loaf, and Filler. Here they are. This is a routine working day of the surgeons in this clinic. From 16 to 20 different operations are performed every day. They last for at least 2 hours. The surgeons are highly qualified specialists in cardiology. Надо просто помедленнее. Это добавляли новый текст, поэтому... Ну и все, необычно. Haven't you heard about St. Catherine and Frederick's Clinic?
Oh, indeed. Here you will be offered a really professional and profound treatment of any cardiac disease. Now presentation of Frederick's Cardiological Clinic. Student Skipenko knows much about this Odessan.
Odryk's Medical Home Clinic deals with prevention and treatment of cardiovascular diseases. CT coronary and angiography is a procedure to diagnose the condition of coronary vessels. Diagnosis and treatment. The most modern types of diagnostic studies of the body are presented in the medical diagnostic department. Today, Medical Home Odryk's is a modern diagnostic center equipped with innovative equipment and using advanced technology in their work. Prevention and rehabilitation of various diseases can be diagnosed in the medical diagnostic department. The most modern types of diagnostics are presented in this department. The surgical care of any complexity is operated in the high-tech patient unit performed by experienced professionals.
Thank you for that. Here is another presentation of well-known Odessa St. Catherine Clinic. Clinic of St. Catherine is one of the private specialized clinics providing all the necessary consulting, diagnostic, and therapeutic care in the field of cardiology and cardiac surgery. This therapeutic and prophylactic institution is one of a new generation equipped with high-class facilities. High professional doctors follow the latest international standards and individual approach to each patient at the level of the best European clinic. Clinic for Vascular Surgery is the department of the Clinic of St. Catherine, has been treating a wide range of vascular diseases. Our specialists have been successfully treating patients with atherosclerosis, cardiac infarction, and myocarditis.
You know, smoking is very dangerous to you, and if you have such a bad habit, you should stop smoking as soon as possible. And now you'll see a conversation between two students of our medical school.
Today many people suffer from...
Медицинская влада, group number 12, will tell us about it.
For boys and girls, it's much better than the choice. You can sledge and ski and skate, and with snowballs we skate. You can swim and play football, hockey, tennis, basketball. You can jump, you can run, you can have a lot of fun. Aerobic exercise increases the supply of oxygen to tissues. It's walking, running, swimming, rowing, dancing, tennis. Natural exercises useful to those who are in the room.
Well, my dear, now we know that there are different remedies and medicine that will help us to restore our health.
When you want to be healthy, you have to keep a healthy lifestyle.
One of the conditions to prevent heart diseases is to keep a healthy diet. Here are some products that help you to clean out the arteries and veins. You listen to student Tkachenko Vladislav, group number 22. He will tell us about healthy food for your heart.
Nutrition has always played an important role in health, for better or for worse. Over time, certain elements can cause blockages in your arteries, causing circulation problems and other cardiovascular diseases that can even cause death. On the other hand, there are foods that can help you to prevent a wide range of illnesses. So the first product is garlic. Garlic is number one when it comes to foods that promote clean arteries. It has very powerful antioxidant properties that are able to fight off free radicals in your body. Next product is grapes. Grapes are rich in flavonoids, which avoid the oxidations of bad cholesterol. Green spinach. Leafy green is rich in vitamins A and C, which, according to a number of studies, can help prevent cholesterol oxidations and problems such as atherosclerosis. Fish. Fish is a great source of omega-3 fatty acids, which also known as good fats. The best fish for accomplishing these goals are salmon, mackerel, tuna, trout, herring, and sardines. Olive oil. Extra virgin olive oil has a wide range of beneficial properties for health, and among them, its ability to prevent heart disease. Tomatoes. Tomatoes are an important source of lycopene, which is antioxidant that prevents bad cholesterol from sticking to artery. Pomegranate juice. It has been scientifically proven that pomegranate juice has higher levels of antioxidants than other juices. Pomegranate juice very good at treating damaged arteries, known as atherosclerosis. Kiwi. This antioxidant-rich fruit works by reduction of toxic LDL cholesterol. Take single serving of kiwi per day to unblock your arteries. Cranberry juice. This juice absorbs the fat and then use it for production of energy. Take 3 cups of this juice each week to clean out your
Our
arteries.
highly fruitful work. Any questions will be welcome. So if you have any questions, please ask them. Raise your hand and ask the question. Okay.
How much time is usually needed to provide these methods of saving the cardiac infarction patients?
Usually from 6 to 7 hours.
Of course, in Israel it decreased to 30-40%.
Это нужно выучить, это откуда вы знали, какого часа читали?
Of course, in Israel it decreased to 30-40%, and in USA to 20-25%.
They are in the USA, Israel, and Austria.
I have a question.
Yes, please.
When was the first operation of coronary artery bypass grafting performed in Ukraine?
Well, in Ukraine, it was the first time it was done in 2000 by Anatoly Rudenko in the Amosov Cardiovascular Surgery Institute. If you have any more questions, no more? Thank you.
By the way, what's Rizava Wikat? Where is she?
Это новое что-то?
Да, это не знаю. Так это еще не завершение. We have already discussed the important...
Не-не-не, она рассказывала, where is she? И она говорит, I'm here. И говорит, а потом вы уже выставки. Вы поняли?
We have already discussed the important problems associated with...
Стоп. Where is she? Вот она выходит и говорит, что она изучила, что она узнала, а потом вы в заключении. Я так говорю.
Так может быть нам об этом сказать?
Но я так не говорила, то вы так написали.
You know, my dear students, I learned a lot of things at your conference. I hope this knowledge is useful for everybody here, especially for you, young medical students, future nurses and doctors. You can use stenting, bypass grafting, replacement of wells and different medications. Thank you for that. I think my weak heart will be stronger now. Be good to your heart.
Well, we have already discussed the important problems associated with diagnostics and treatment of cardiovascular diseases. And we hope that this information will help young students, will help young students in their future work when they become specialized doctors.
Okay, and now at the end of our conference, we would like to relax a bit after our highly scientific work, and we would like to offer you to listen to a poem dedicated to the human heart.
You will have an opportunity to listen to our talented student, Serbu Maria. She will tell a poem by Robert Burns, My Heart's in a Highland. He grew...
The poem by Robert Burns sings the beauty of his native land where he spent all his life.
He glorified true love and friendship. In his poems, he gave all his heart to his native land, Scotland.
My heart's in the Highlands. My heart is not here. My heart's in the Highlands. It chases the deer. It chasing the wild deer and following the road. My heart's in the Highlands wherever I go. Farewell to the Highlands, farewell to the north, the birthplace of Vela, the country of God.
Это грусть.
Наоборот, здесь надо громко говорить.
Farewell to the Highlands, farewell to the north, the birthplace of Vela, the country of God. Wherever I wander, wherever I roam, the hills trees of the highland, forever I love. Farewell to the highlands high covered with snow, farewell to the straps and green valleys below, farewell to the forests and wild hanging woods, farewell to the torrents and love-pouring floods. My heart's in the highlands, my heart is not here. My heart's in the highlands, it's chasing a deer. A chasing the wild deer and following the road. My heart's in the highlands, wherever I go. Wherever I go.
Папка desktop.
Now the translation.
And now the translation.
Into Ukraine.
Into Ukraine. Моє серце верховині і душа моя, моя дума верховині соколом буя, моя мрія в гори лине над здогін вітрам, моє серце верховині, де б не був я сам. Будь здорово, верховино, любий рідний край, честі й слави батьківщину, вольності розмай. Хоч іду я на чужину, повернуся знов, моє серце верховині і моя любов. Прощавайте білі гори, прощавайте сині гори, білі сніги, прощавайте темні звори, біляві луги, прощавайте пущі дикі тіняві гаї, прощавайте буйні ріки, бистрі ручаї. Моє серце верховині і душа моя, моя дума верховині соколом буя, моя мрія в гори лине на здогін вітрам, моє серце верховині, де б не був я сам.
For your kind attention and cooperation. We would like to thank our best students for participating in this ceremony. They are... Я считаю, что мы с тобой друг другу должны представиться на конце. They are Andrushenko Alexander, group number 30. Tkachenko Vladislav, group number 22. Skipenko Lyubov, group number 30. Zubritskaya, если неправильно выговорю. Zubritskaya Daria, group number 30. Dudnik Anna, group number 31. Shvets Yuliana, group number 31. Rozlovan Diana, group number 20, as well as Sichova Nastya and Sirgu Maria, group number 30. And Shvets Denis.
And Bugayova Anna. Можно сказать, типа, Masters of Ceremony. Bugayova Anna.
And Shvets Denis. Or Denis, Shvets, неважно.
Ceremonies.
Master of Ceremonies?
I just call ceremonies. Почему?
Потому что так называется.
Thank you and have a wonderful day. Farewell.